Thank you for your interest in being designated a healthy Utah community. This designation is an important way to show your residents and the rest of the state that your community is serious about well being. So, over the next few minutes, I want to walk you through the requirements to qualify as a healthy Utah community and give you the information you need to confidently apply. To begin, let's review the 4 basic steps for qualification. First of all, your community must submit a letter of commitment from your mayor and city council. If your community is unincorporated and doesn't have a mayor or city council, don't worry. You can still apply. We just ask that the letter be completed and signed by an equivalent level of leadership. To make the letter of commitment easy for you, we have created a letter template that can be accessed here on our website. You are welcome to follow the wording of this template closely or make as many changes as you see fit. All we really ask is that you customize the letter to reflect your community's unique commitment to health and to best summarize your efforts to earn the designation. After the letter has been drafted, we ask that it be signed by the mayor and city council. You can add the signatures of each and every city council member or just the chair of the council. It's up to you. The next step in the designation is to organize a community health coalition. Now, this doesn't necessarily mean that you have to organize a new coalition from scratch. If your community already has a coalition that meets together regularly to discuss health, you are welcome to use that coalition for the application. What we do ask, though, is that this coalition be assigned the responsibility of overseeing health initiatives in your community and keeping your Healthy Utah Community designation current. The designation lasts only 3 years. And to be redesignated, your community will need to demonstrate an ongoing commitment to health. We'll talk more about that later in this video, but what's important to understand right now is that the health coalition you are applying with should oversee the fulfillment of your 3-year community health plan. So if you don't have a coalition that is already a good fit for that task, it may be advantageous to create a new one. At a minimum, we require that this coalition consists of 4 individuals who meet together quarterly, but that's the minimum requirement. For best outcomes, we advise inviting more than 4 individuals to join the coalition and meeting together more often than quarterly. We've provided a list here of important and valuable organizations you should consider inviting to join. And if you want to invite a representative from your local health department, we've even included an easy-to-use contact list hyperlinked within the application. You can look here to find the appropriate point of contact based on your geographic location. Then once your coalition is organized and meeting together regularly, we ask that you tell us about it. Tell us who is in the coalition, how often it meets, when it was organized, then use this space below to tell us any additional relevant information. For example, we would love to hear about the projects your coalition is working on and any important successes you've had. And that's it. Assembling a health coalition is not as daunting as it may first appear. The third step now is to implement evidence-based strategies to improve community health. And some of these strategies you may already be doing. We've divided the strategies into 3 categories: active living, access to healthy food, and mental health. Every community needs to implement at least one strategy from each of these categories, but the total number of strategies depends on population size. Small communities that have a population less than 10,000 will need to implement one strategy from each of these categories for a total of 3. Mid-sized communities with a population between 10,000 and 65,000 will need to implement 2 strategies from each category for a total of 6. And large communities with over 65,000 residents will need to implement 3 strategies from each for a total of 9. As a community, you are welcome to come up with your own strategies that improve physical activity, healthy eating, and mental health. Or you can pull ideas from our recommended strategy list, which you can view here. Or you may also pick from our menu of services, which you can likewise view here. This menu of services highlights a wide assortment of programs that are available statewide that might be of interest to your community members. If you implement one of these programs, we will count that as a strategy. So, to repeat, your health strategies can come from our recommended list, from our menu of services, or be a strategy that you came up with on your own. Just be sure that the strategy really is worthwhile and really does improve health. If not, we may not be able to count it towards the designation when reviewing your application. So, if you have any questions about whether or not a strategy you came up with would count, don't hesitate to shoot us an email. We would be happy to talk it through with you. And keep in mind, you don't have to start from scratch. If you are already doing any of these health strategies, we would love to know about them and count them towards your application. What we want to know is what your community is already doing and provide recognition for that. And that's it for health strategies. The next final step of the application is simple. It's creating a 3-year community health plan. To put it simply, this requires telling us what health strategies you haven't done, but hope to do soon. This is important because, as I mentioned, the Healthy Utah Community designation only lasts 3 years. To be redesignated, you will need to submit another letter of commitment, show that your health coalition continues to meet, and demonstrate that you are continuing to implement more health strategies since you were first designated. We want to know you've continued to work on improving health. And that's where this 3-year community health plan comes into play. The plan is simple, but it's also important, and your health coalition can help draft it. But what we ask is that you look at health data for your community and really come to understand its needs. We've included links here to the Utah Healthy Places Index and also to the Public Health Indicator-Based Information System, also known as IBIS. We'll soon be doing a webinar about how to best use these tools, and we'll post the recording to our website as a resource. But all you need to know now is that these tools are intuitive and easy to use. Simply look at the data for your community produced by both tools, then answer the questions below. If you really want to take a deep dive into the health of your community, which we do recommend, we've also included a link to the Utah State University's Wellbeing Survey. This is a free survey on health that the university can help you conduct. Another option is to reach out to your local health department. Health departments regularly conduct community needs assessments and may have valuable data to share about your community. So after looking at the data, you'll answer these 2 questions to help you think about it deeply. Then we want you to use the information to guide your selection of additional health strategies. Strategies that, like I said, you haven't implemented yet, but want to work on over the next 3 years. So let's say, for instance, you found in the data that your residents have a hard time eating enough fruits and vegetables. Perhaps then you will focus on implementing a strategy from the access to healthy food category and decide to start building a community garden. The options are flexible and totally up to you. Again, the list of recommended strategies and menu of services can be great resources here. And please keep in mind that the strategies you indicate here are not strategies you are already doing. Instead, they should be new strategies that will fulfill a need in your community. And again, just like step 3, the number of additional strategies you need to implement over the next 3 years to maintain your designation depends on population size. Small communities will need to select 1 strategy to work on over the next 3 years. Mid-sized communities will need to select 2, and large communities will need to select 3. They can come from any category or combination of categories, depending on the needs you identified in the data. And really, that's it. These 4 steps, submitting a letter of commitment, organizing a health coalition, implementing evidence-based health strategies, and creating a 3-year community health plan, are all the steps necessary to be designated a healthy Utah community. If you've met these steps, you are ready to apply. Simply come back here to the main Healthy Utah Community webpage and look below to find our email. At any point in your preparations to be designated, you are welcome to email us and we will send you a fillable application that looks like this, a fillable PDF, or also this, a Word document that you can fill out. You are welcome to use either the fillable PDF or the Word document, just depending on whichever format you prefer. But either way, the forms ask for the same information. Then once your application is complete, you will email it back to us using, again, this email address. And that's it. Get Healthy Utah staff and board of directors will review your application, then reach back out to let you know if you qualify. If not, and you came a little short, then we will work with you to make the improvement still needed. And keep in mind that there are 2 application deadlines each year. To be recognized at the Utah League of Cities and Towns conference in the spring, you will need to email us the completed application by March 1st. To be recognized at the League conference in the fall, you will need to email us the application by August 1st. Remember that once you've been designated a Healthy Utah Community, the designation will last for 3 years. At the end of the 3 years, you will go through these same steps to reapply. You'll resubmit a letter of commitment, show that your health coalition continues to meet, and prove that you fulfilled your 3-year community health plan. You'll then draft another for the next 3 years, and your designation will be renewed. You can expect an email from Get Health Utah staff with a reminder and further instructions before it's time to reapply. And as always, if you have any questions, you are always welcome to reach out. Our email address is open to questions as well as application requests. And if you want to schedule a meeting with our staff or have us provide a presentation about the designation at your next city council meeting, reach out. We would love to hear from you and help your city or town qualify to be a healthy Utah community.